Shaqaalaha caafimaadka ee Garissa ayaa maanta sameeyay dibadbax ay uga cabanayaan daryeel la'aan xagga shaqaalaha tan iyo markii waaxda caafimaadka lagu wareejiyay ismaamulada county-ga. Sarakiisha caafimaadka oo socod dheer ku maray magaalada ilaa xafiiska gabanaha Garissa ayaa ku baaqay inay sameynayaan shaqo joojin inta laga xalinayo cabashadooda iyo baahiyaha ay sheeganayaan. Shaqaalaha oo aan helin xuquuqdi ay lahaayeen ee asaasiga sida ay ku ayaa waxaa horaan u ballan qaaday gabanaha Garissa Nadif Jamac inuu maareyn doono baahiyahooda balse ilaa hadda wax miro dhal ah aysan yeelan. Waa kuwa qaar ka mid ah sarakiisha caafimaadka oo afaafka hore ee xafiiska gabanaha afka furteen.
So good morning our fellow members. We are health workers here from Garissa County, from all the 7 sub-counties in the bigger Garissa County. We are having health issues like healthcare workers, ranging from promotion and resignation. Our members have not been promoted for the last 12 years. Since many of us were actually employed in 2014, and our seniors who were promoted last in 2015, there have never been subsequent promotions. So we've come here several times, meet the governor. Last year we signed an agreement with the governor in November, but to date, after the lapse of 90 days, nothing has actually been fulfilled. So we have actually demonstrated from Garissa County Referral Hospital to the governor's office so that we can register our displeasure and actually ask the governor to humbly implement the agreement, which ranges from promotions, redesignation of our officers who have actually upgraded their studies, so that they can actually be placed on their respective job groups. There is also issue of a comprehensive medical cover. The county contracted Britam, but Britam is only benefiting those who are in job group P and above. So we are urging the governor to have a cover, comprehensive cover, which is fair to all the health workers and is actually beneficial to all healthcare workers. We also have an issue of career progression. Our members are actually not given study leave, so they are not able to career progress. So we also ask for intervention so that our members can actually be allowed to progress professionally by actually given their study leave. We also have an issue of pending arrears for leave allowance and also arrears for nurse uniform allowance. The previous governor, we had 7 years leave allowance had not been paid, and also we have 2 years for uniform allowance for nurses which has not been paid. So we ask also that to be paid so that we can actually go back to our work. We also have the issue of NAMLO as our union being recognized officially. That doesn't have any budgetary implications, but the county government had actually not been able to do it. We also have a CBA for nurses, which was registered in the county government respective offices, but that has not also been signed. Those are the major issues that are actually in contention. So we ask the county government, especially the governor, we are actually feeling it for our patients. We don't want our patients to suffer. So we ask him to implement all these things as early as possible so that we can be able to go back to our working areas. Other than that, we shall be here to seek audience with the governor tomorrow, the next day, until he implements the agreement so that we can actually go back to our working places.
I'm Ismail, the branch secretary for Kenya National Union of Nurses and Midwives in Garissa branch. We are here because of an atrocity and inhuman treatment meted on healthcare workers in this county. We are here on human resource issues, among them promotion and resignation, leave allowance and uniform allowance which is in arrears. We are speaking about CBAs which are not signed and implemented. The governor was in record. He has promised he will be here he's going to implement for 90 days. It's now more than even 120 days. The governor is not even speaking about issues. It has been promises against promises since 2017. We are now tired. We have down our tools officially, and our ultimatum is, unless the human resource issues are going to be solved, we are not going back to our duty station. My message to the president of this country, health system in these counties it is a scam. We want National Health Commission. These governors, they don't want to consider about human resource issues in this country. human resource for health is the largest building block in health system. So what we are saying to the governor, we want health service commission.
My name is Abdi Fatah. I'm the chairman of Kenya Union Clinical Officers, Garissa branch, and I'm appealing to the President and the Cabinet Secretary of Ministry of Health about the UHC staff. UHC is a universal healthcare coverage. It's a big program for the government, and the backbone of the UHC is primary healthcare. Primary healthcare, the staffs who are serving primary healthcare, among them are clinical officers who are under UHC program, and they are being paid half salary and against half salary, which is discriminative, and it's not good for the staffs. The staffs are demotivative, and we are urging the President and the Cabinet Secretary to fast track the issues. We are aware that UHC staff, all of them are, there is a nationwide strike which and all of staffs, the nurses, the medical labs and the CEOs are under strike. So we are urging the government to fast track that issues and to absorb these UHC staff to permanent and pensionable. Thank you.